news, everyday news on Prince Miller Entertainment TV. Today is the 23rd of September 2022. Remember, guys, to like, share, comment, and follow, and turn on the notification bell so that you won't miss any of our new uploads that you do upload here on this channel each and every day, each and every hour. And so, guys, Auditor General Mildred Chiri has exposed the rot in the country's health sector, where there is serious understaffing and shortages of equipment, with no ambulances having procured between 2019 and 2020. According to Chiri's audit report on the appropriation accounts, finance and revenue statements and funds accounts for 2021, Zimbabwe is facing a serious health crisis. A report came at a time when South Africa is accusing Zimbabweans of straining the neighboring country's health care facilities. In a report, Chiri said the Harare Government Dental Center, which is the country's largest referral center, is operating below capacity with insufficient human resources and equipment. I noted that delivery of dental services was negatively affected as the health institution was operating below capacity. The health institution did not have sufficient human resources, financial resources, infrastructure, and equipment, Chiri said, referring to the dental center. During my visit to the health institution, patients were being turned away because of the unavailability of dental equipment to perform the necessary dental procedures. The facility, which offers oral health services to patients and provides training and internship to dental technicians, therapists, and assistants, requires 8 dental chairs and 8 dental mobile carts, but it is only has 1 of each. It also requires 4 autoclaves sterilizing equipment, 4 air compressors for dental procedures, and 2 dental x-rays, but it did none. The dental center also has no water and power backup. An analysis of human resources showed that in 2019, employees in post were 63% of the establishment, but the figure decreased to 53% in 2020. The health institution was offering training for dental therapy assistants, but the number of students had significantly declined, a situation that may see the country having no therapist. The institution should be training 30 therapists each year, yet in 2019, 15 therapists were trained, and in 2020, 10 therapists were trained. Service delivery to the citizens was not being effectively rendered as there is a limited number of patients being assisted. The country may end up with no therapists if annual numbers of trainees continue to decline, Chiri said. Management at the institution claimed that the health ministry was engaging the finance ministry for financial assistance. Apart from that, a public-private partnership between Nyanga District Hospital and Nyaradzo Funeral Assurance Company was not regularized and remained a verbal agreement, Chiri noted. Previously, I reported that Karowe District took a long time to submit medical aid claim forms to medical aid societies. Marondera, Bindura, and Karowe hospitals had medical aid claim forms for Premier Service Medical Aid Society, a National Society Security Authority, that were rejected and had not been followed up. In 2018, I reported that Masvingo and Gweru provincial hospitals failed to support creditors' balances as they did not maintain creditors' records. The situation is still the same, she said. Chiri exposed unsupported expenditure at 11 health institutions visited in 2018, which occurred expenditure amounting to $160,295 that was not fully supported by source documents such as requisitions, invoices, or receipts, as well as goods received notes. 9 health institutions visited in 2018 incurred expenditure amounting to $143,154 without seeking competitive quotations and subsequently compiling comparative schedules. Also, the health institutions had no service level agreements in cases where acquisitions of goods and services was from a sole supplier. For the financial year ending December 31, 2020, the head office, Harare Dental Center, and Government Analyst Laboratory did not maintain complete and proper accounting records relating to the Health Services Fund. The report said the segregation of duties in the Accounts Department was not observed during the period under review at the Government Analyst Laboratory and Harare Dental Center. The officer who was responsible for receiving revenue was the one receipting banking, updating the cash book, and preparing the bank reconciliations. Furthermore, at Harare Dental Center, the officer who was responsible for approving requisitions was also responsible for satisfying and passing vouchers for payments. Chidi said the crisis in the health sector is likely to escalate further, with NPF legislators pushing for entrenchment of the private voluntary organization PVO's amendment bill, which will likely chase away donor funding from the sector. Finance Minister Mthuli Ncube allocated only 40% of the 2022 national budget to the health ministry, leaving donors to fill in the gap. Health experts who spoke yesterday said the health sector would be crippled if non-governmental organizations (NGOs) were banned, as the sector gets almost 85% of its funding from NGOs. Medical and dental private practitioners of Zimbabwe, President Johannes Marisa said ZANU-PF utterances were just political banter, as Zimbabwe could not survive without NGOs. That is mere political statement. There is no country that can run without NGOs, which remain very important because they contribute very significantly to the growth of the health sector. Donors are the ones that also give incentives, especially in the rural areas. We cannot afford banning these NGOs in a developing country, especially here in Zimbabwe, Marisa said. Zimbabwe Nurses Association President Enoch Dongo said, let's put politics aside and let's be realistic. Looking at our economy in Zimbabwe, there's no way we can sustain the health ministry without the help of donor funds and NGOs. It will not be fair for political reasons to talk about the donors that are in the health ministry, as they are apolitical. We haven't had any donor that is pushing a political agenda as far as the Ministry of Health is concerned. These donors are only playing social responsibility roles. They are even assisting in rural areas, Dongo said. Health professionals set free, Mafukize tweeted, nurses in Zimbabwe are paid registration allowances by NGOs because the government cannot afford that. 85% of the health ministry is donor funded. Health ministry spokesperson Donald Mujiri said donors contribute a lot to the health sector. The Minister of Finance can give you an accurate figure on how much they contribute. And so if the donors are contributing so much, why is the government pushing for this bill, and which I talked about it here so many times, private voluntary organization PVO's amendment bill, which will restrict my donors until the end. We're gonna see most of these donors who are helping in the rural areas, but you see I know at Isusu I think operate in a country whereby the government is doing this to us. And so this is daily news, breaking news, everyday news on Prince Melan Entertainment TV. Yes, I still think that the health ministry is the one of the worst run health ministry right now. Pama ministries, yes, since 2018. And yes, since this Second Republic, I still feel like they've neglected the health sector. And then you hear these politicians apama campaign arikuya manje vachitara nyaya ezvipatara vachiti muzvipatara mine mishonga makatase vanenge vachitonyepa vachida mavhoti chete kuti tivavhotere ma-MPs ma-councillors vachitara zvina basa, so it just shows that these politicians, they are not in it for the people, they are in it for themselves, because even they can afford to fly overseas kuti vanogadziswa mazino avo. Munangonzwa mudumbu chete atokwira ndege aenda kuSouth Africa kunotaswa mudumbu make maita sei, but tisu varombo manje uenda ikoko dental center yewonzonzi hatikwanise kukubatsira because hatina equipment yekushandisa zveshuwa vanenge vasina zveshuwa. And saka what I say, rarama wakadaro because there's nothing much you can do, because kuti uende ku-private hospital vanenge vachiuda mause ako mberi, and not all of us can afford to go private. And so this is reality, and that's why South Africa vari kuti aiwa isusu taneta nekubatsira maZimbabweans ari kuyambuka border vachiuya kunoku kuzobatsirwa for medical attention, and yet you guys muramba makanyarara mutange musuzviona pa zviri kutoitika. And so they had the right to complain on that video, they had the right to say all those things they said on that video, because it really exposed that our health crisis in Zimbabwe is not just a health crisis, it's real. It's like it goes deep, it really goes deep to the core. Nyaya the corruption, nyaya the lack of workforce, because vazhinji they're now going overseas. Angada kutambira mari yakadai so pamwedzi, iye akaita 7 years 8 years achienda kuuniversity ozopuwa $175 per month, mari isingatenge. And so this is daily news, breaking news, everyday news on Prince Melan Entertainment TV. We keep you guys up to date, but this isn't a good look, especially for us, the poor, because ndo kwatinonoraramira tiri ikoko. It's everyday news on Prince Mila Entertainment TV. Bless up.